Gordon Payne is trying to download the new COVID Alert app.
It says I need a different version of the operating system that my phone cannot handle.
It requires users to have Apple or Android phones made in the last 5 years and a relatively new operating system. Payne has an iPhone 6.
Not everybody has the ability or the financial means to afford the latest technology that is required to run this software.
This Ontario NDP legislator says her parents also tried, in vain, to download the app on their older iPhones. Now she and others are raising concerns about accessibility for older Canadians and marginalized groups, some of the most vulnerable people when it comes to COVID-19.
It's not enough to build a tech tool that works well for white Canadians or affluent Canadians. It needs to work for all Canadians, or the government needs to be really, really clear as to why they are not doing so.
For now, the app is only linked to the Ontario healthcare system. Atlantic Canada will likely be next. This Manitoba restaurant owner has been trying to follow what he calls confusing public health orders.
When you walk around the patio, you can see all the tables and chairs are spaced out.
He knows his industry is frontline, so even though he's not a fan of more government intervention, if the COVID Alert app becomes available, he'll likely download it.
To make sure that any people I'm with who, could be seriously injured by a respiratory virus, protecting them and keeping them safe.
Meanwhile, Gordon Payne has asked the Ontario government to fix the download problem. He's a high school teacher and will soon be surrounded by students.
If I come into contact with them and one of them tests positive, I would really like to know that for the benefit of my health and the people around me.
At least 65% of Canadians need to use the app for it to be effective, and that won't be possible unless the federal government finds a way to make it more accessible. Karen Pauls, CBC News, Winnipeg.